this is a marathon. You might lose hope in between, but just push yourself to the limits. Keep working hard. There's no substitute for hard work. Eventually things will start looking up. Sometimes you might feel like giving up, but just remember what awaits you at the end of the journey. Believe in yourself. That is the most important thing. If you think that you can do it, you will actually do it.
In coaching, they are there to build up your base or to revise it for you. Then later on, you have to go and add on through whatever you feel have been asked in previous question papers, or you have to build up on that. All the subjects are very volatile. You have to make sure to frequently revise them to store in your brain, because there is infinite knowledge out there and question can come from anywhere. So you have to prepare for that. What I'll say is to revise all the subjects frequently.
I know it's a tough thing. It's very difficult. We see so many people, preparing well. We get nervous, we get tense, we even get depressed. But one thing you have to keep in mind is that you have to keep, firm belief in yourself. Always remember, you are here at this point because in class 12th, you were better than so many other people who appeared. That is why you became a doctor, correct? Have that faith in yourself and you will do great. That's all. All the best, everyone. Thank you.
Start as soon as you can. Just even if you don't start seriously, just go through some of the notes. Just keep on making concepts. Don't study hard at the start if you want, but at least start studying something so that you are in touch with the subject. And then once you start preparing for PG, whenever it may be, maybe it's during internship or after internship, just start doing MCQs as you are going through your notes, and start jotting down the extra points in your notes, and especially revise the notes. That's the main thing. Just reading it once won't help you in the exam. In the exam you'll get confused like anything. So you need to revise the notes and be thorough with it. So that's all. All the best for your future exams.
PG entrance, it seems like a big thing, but if you are focused, if you know what you want, you decide your goal, then accordingly you plan, you schedule, you like maybe ask your seniors and ask your teachers which subjects to focus on. Divide your time between the different subjects, and then you can, like, if you have to be smart when you're preparing for PG. You cannot just like go on into the detail, like 1 month you're reading medicine only. You can't do that. Can't afford to do that. So be smart, be focused, and never lose hope, never lose your confidence. Always have the faith that you can do it, and always be one thing I would like to add is always look after your health, look after your mental health. That is very important, and with a healthy body and healthy mind only can you study well. And always, I mentioned this before also, always talk to your family and friends, and always keep them in the loop as to what is happening with your preparation, what is happening with you. And rest, I want to say that don't lose hope. If you haven't done it this time, you know where you've gone wrong. Analyze your strengths, analyze your weaknesses, and you'll definitely be able to do better next time. So all the best to all the future PG aspirants.
My message is, preparation time may be a short journey or long journey. It all depends on you. When you started, how do you started, how good your concept is. But make sure to have that mental peace. Don't exhaust yourself. Keep a pace of study and keep on studying every day. Don't miss a day without reading, and revise them frequently as much as you can, because revision can only help you to retain all the subjects and then reproduce them in the exam. Because most of the time is people have read the subjects and they don't tend to revise. If they don't revise it during the exam, they feel like I have read this, I know this, but I don't know what is the correct answer. They get confused. This confusion will only go away when you revise a lot. And do not worry, no one can master all the 19 subjects, because each subject is a super specialty or a specialty within themselves. So you all are just a MBBS graduate, so make sure that you know, educate to go to the exam or to have a good concept. Even if the question comes from totally from a new area, if you have a good concept, you will be able to guess it, you will be able to eliminate it. There are a lot of techniques, and don't worry, you will all crack it. All the best.
You have tests, give weekly tests, give subject-wise tests, assess yourself where you stand. Don't make your strong areas stronger, concentrate on your weak areas. Entrance exams are not about like how much in depth you know a subject, it's about like how much you know overall. So you have to cover everything, and you need to have an idea about everything. You don't need to go in depth about everything. You don't need to like go into research papers and dig up facts. Just basics and just cover everything. You have to earmark your weak areas and just focus on those weak areas and keep doing questions. There's no better method of preparation than doing questions. Once you keep doing questions, you'll know your weaknesses.